extra video is going to look at leukocytes, otherwise known as our white blood cells. So general characteristics of white blood cells, their main job is to respond to foreign particles, debris, bacteria, fungus, cells that are mutated. They help protect our body. It's an immune function. They are less numerous than erythrocytes. There's only about 5,000 to 10,000 per microliters versus the millions that we had of erythrocytes. They are considered a complete cell, so they have a nucleus and organelles, which again makes them different than red blood cells that don't have the nucleus or organelles. There are only one type of red blood cells, but there are different types of leukocytes. Each one will have a very specialized structure and function. They have a shorter lifespan than a erythrocyte, and they are capable of moving across blood vessel walls to surrounding tissue. And this is really important because foreign material like bacteria, fungus, viruses, they aren't always located within our blood vessels. They're in our tissues. So the fact that these white blood cells can come and go in and out of vessels, arteries, and veins is a really important characteristic in helping them in their immune function. Leukocytes are classified into two categories: granular leukocytes and agranular leukocytes. So granules are going to contain abundant granules in the cytoplasm, so you can actually see these under different staining techniques. These are going to include neutrophils, eosinophils, and basophils. Agranular leukocytes, they have the granules, but they're a lot less obvious, especially under staining. And this is going to include lymphocytes, which are your natural killer cells, and your T and B and memory cells. T and B lymphocytes, and then memory cells. And then monocytes are also considered agranular. So looking at each one of these, let's start with the neutrophil. You're going to be identifying these during lab, so you might want to draw the pictures just to kind of help you. But neutrophils make up 50 to 70% of the total leukocyte count. So if we do a blood sample and we're just looking at all of the leukocytes, not looking at the red blood cells, then neutrophils are going to make up the majority of the types of white blood cells. They're significantly larger than erythrocytes. You can see right here, here's a erythrocyte, and then here is a neutrophil. Their granules, when they are stained, are going to appear light lilac in color, kind of light purple. They're called neutrophils because we stain them with a neutral stain, so not acidic or not alkaline. The nucleus is lobed. There's usually 2 to 5 of them. They are rapid responders to the site of infection and are particularly effective against bacteria. So if you have a bacteria infection, you would have a higher neutrophil count than normal because these are going to be activated to try and fight that infection. So high levels are going to indicate bacteria infection or inflammation. Neutrophils also start to proliferate when there's inflammation occurring. Also, they're going to be higher levels of than normal in burn victims. And again, that's because they're going through a really excessive inflammatory response. So those neutrophils are going to reproduce much more quickly in order to deal with that situation. So again, here's a neutrophil. You might want to draw what it looks like. You'll be looking at these a lot in lab. Eosinophils are 2 to 4% of the total leukocyte counts. So their granules are kind of going to stain orangish. And it also has a lobed nucleus. Usually there's two lobes, 2 to 3. Granules are going to contain antihistamines, so they're going to counter inflammation. These are particularly effective against parasitic worms. If you have a high level of eosinophils, it typically means you are having an allergy response of some kind, or you have a parasitic worm infection. Some autoimmune diseases also produce higher than normal levels of eosinophils. And again, you can kind of see compared to these over here, which are the red blood cells. Basophils are the least common of the leukocytes, less than 1% of a total leukocyte count. They're the smallest of the granular leukocytes. Granules are really, really dark blue. And the nucleus has 2 lobes, but they're really hard to see because the granules stain so dark that the nucleus kind of just blends in. So you're going to get a really dark dark center. Their job is to intensify the inflammatory response, so they release histamines, which is going to cause an increase in inflammation. If you have a high level of basophils, typically it means, again, you're having a high allergy count. It can mean that you have a parasitic infection, and it's a really good indicator for hypothyroidism, so your thyroid not working as well as it should, underproducing. And if you have low levels, that are going to be associated with pregnancy, stress, and an overactive thyroid and hyperthyroidism. Going to the granulocytes or the agranular leukocytes, agranular, so without grains. And you can see here that that cytoplasm, it's just not as obviously grainy. But lymphocytes is the first one. They're the only formed element that arise from the lymphoid stem cells. Most of their development occurs in the lymph tissue, so that's unlike the rest of the white blood cells. This includes natural killer cells, which recognize abnormal cells like cancer cells and can attack them. And then B cells and T cells, which are involved in our specific immunity. And we'll talk more about that next week. But plasma B cells are going to produce antibodies. So when we get vaccine, they're going to stimulate these particular types of cells. Memory B and T cells are those that are formed after exposure to a pathogen. So again, involved in vaccines and antigen long-term antigen antibody responses, and they live for a really long time, longer than any of the other formed elements. If you have a lot of lymphocytes, it indicates a viral infection, so cells that have been invaded by viruses. It also is a sign of cancer. Low levels can be found in the immunocompromised, which makes sense because these are involved in, fighting off infections. So you're going to have lower of them if your immune system is not functioning properly. And then monocytes is the last agranulocyte. They make up 2 to 8% of the total leukocyte count. They're really large. They have a horseshoe kind of shaped nucleus. You can see that right here. Macrophages are monocytes that have actually left circulation, so they've left those blood vessels, and their job is to, again, they're like Pac-Mans, they go around and they destroy or eat up foreign pathogens, cellular debris, worn out red blood cells. We talked about that in the last video. If you have a high level of monocytes, it indicates that you might have a viral or a fungus infection. Monocytes are really effective against fungi. And if you have a low level, it indicates that you have suppressed bone marrow. So this can be a good indication that maybe your bone marrow isn't producing red blood cells the way that it should. Disorders include leukopenia. This is a condition in which too few leukocytes are produced. If this condition is diagnosed, the individual may be unable to ward off disease. Excess leukocyte proliferation, which is known as leukocytosis. Although leukocyte count is high, the cells are abnormal, so they don't work the way that they should, leaving the individual at risk for disease. Leukemia is a cancer involving an abundance or too many leukocytes. It may involve only one specific type of leukocyte, or it can involve more than one type. Basically, what happens in chronic leukemia is the leukocytes accumulate and they fail to die. And then in acute or short-term leukemia, there's basically an overproduction of young, immature leukocytes. In both cases, those cells don't function correctly, and you are at an increased chance for infection. Lymphoma is a form of cancer in which masses of malignant, cancerous T or B lymphocytes collect in the lymph node, the spleen, the liver, and other types of tissues. These leukocytes, again, just like the other examples, don't function properly, and the patient is vulnerable to infection. There are different kinds of all of these disorders. So, for instance, you can have Hodgkin's lymphoma or non-Hodgkin's lymphoma. Some of them are going to be really easily treated and you'll have a good prognosis. Others are not, and the prognosis isn't as good.